PT Control Patella Tracking Orthosis from Medi. The PT Control is a unique knee brace, and that its purpose is to force the patella to track properly through its range of motion. It does this through a patented device that matches what the knee is doing through the PhysioGlide hinge and tracks what's going on with the patella through a buttress that has an air foam bladder on the underside that's connected directly to the 4-bar PhysioGlide hinge. So to give a good illustration of what's actually happening with this device, we're going to pop off the hinge so that you can see how the hinge actually works. So we'll put that there. Okay, so the PhysioGlide hinge is a patented Medi product, and it has extension and flexion stop capabilities as indicated by the black flexion and silver extension stops and indicators. It's a 4-bar linkage, so you can see 2 of the pivot points here, but as you move through the range of motion, you'll notice that it tracks the way your knee would. So it rolls and glides the way a knee is supposed to move. But you notice also that the patella tracking mechanism is part of the hinge as well. So as you move through your range of motion, it's extending and flexing, keeping a constant pressure on the lateral aspect of the patella, forcing the patella to track properly. So for your patients that are suffering from a post patella subluxation, post dislocation, those types of indications are excellent for the PT Control. The range of motion stops, they're very easily adjusted. We'll leave the extension stop alone. It has a 0 in it right now, but it comes with a selection of varying extension, which extension stops are all silver. Flexion stops are all black, which match the silver and black logos on the hinge cover. So we will put in a -90. I chose a -90 because it's very common to see a -90 as part of a protocol, because when your knee goes into deep flexion, the channel that the patella tracks through is vulnerable when you're getting that far into deep flexion. So to put a 90-degree flexion stop into the PT Control, all you simply need to do is, you can see the back side of the brace right there. Simply slide it in, match it up. You can see how it matches up in the window. See the little triangular window? It's matched up nicely there. Take one of the Sublide screws, put a little Loctite on it. Blue Loctite is what you would want to use here. Slide it in there. Tighten it down. And you're ready to go. Now the brace is blocked at -90. So let's take a look at the other side of the brace. When putting in a flexion extension stop, you'd want to make sure that you have one in each hinge. Otherwise the brace will twist and not function properly. So to do that, again, simply select your 90. Now you notice on this hinge it says L. That indicates that this is the left hinge, not the left leg, the left hinge. Match it up with the L that's on the stop. You can see that that says L90. So we're going to slide that right in here. Again, just like we did the other side. We'll slide the screw there. Slide the cover or the screw into the So, I guess we got a warning button here that says that we're overdue. So we'll pop the cover back on there. Just having a little fun there. Pop the cover back in. Go back over here. Put it back together. You can see it's very easy to assemble the product. So let's tighten her down. Okay, so now we have our stops in. Now we're blocked at 90, and we have 0 still in for extension. Oftentimes a protocol will have a -10 required for the extension stop. To do that, you simply pop the cover off, put the -10 silver extension stop in where the current 0 extension stop is, and then you're set with your -10 extension, -90 flexion post-injury protocol for patella subluxation patient. So some of the other features of the PT Control. The PT Control buttress is adjusted with the 2 straps that connect to the buttress itself. This provides the proper amount of downward force. The strap, the hinge bar straps are adjusted in order, and they're numbered. Posterior strap, this one is very important. It sits just above the curve of the calf, providing a good shelf for the brace to sit on so that it does not migrate. And the liner itself is a Medi Airtex liner, which has a bit of lycra in it so that it maintains its shape, but it's also very cool and moisture wicking, so it's very comfortable for all-day use. The PT Control is available in sizes from extra small through double extra large. To size the brace properly, 6 inches above mid-patella measurement is what you would want to take. That's it. Thank you.